My name is Juan German, and I'm the Assistant Cultural Affairs Officer here at the U.S. Embassy, and my focus on exchanges and alumni. So I wanted to welcome you to the Pakistan-U.S. Alumni Network Public Interest Group session celebrating World Anti-Microbial Awareness Week 2021. We're so grateful for you and your time and interest in this very special event today. We hope that this discussion will be informative, fruitful, engaging for all. I wanted to give a special thanks to our panelists for their time and support and for their willingness to share their expertise with us today. Celebrated annually, the World Anti-Microbial Awareness Week aims to increase awareness of global antimicrobial resistance and to encourage best practices among the general public, health workers, and policymakers to avoid the further emergence and spread of drug resistance infections. In 2021, the theme is Spread Awareness, Stop Resistance. Calls on healthcare workers, policymakers, health providers, and the general public to be antimicrobial resistance awareness champions. Today, we have the opportunity to hear firsthand from world-renowned experts on their perspectives regarding this super timely topic. We are so thankful to Dr. Usman Zaheer, USG, Fulbright alumnus, and his team from the Fleming Fund Country Grant, Pakistan, and all local and international partners for collaborating with us today. It's an honor and a pleasure to work with such outstanding organizations. So without further ado, on behalf of the U.S. Mission to Pakistan and Juan, we are thrilled to welcome moderator Fardad Baig, Fulbright alumnus, as well as a distinguished panelist from the United States, Thailand, Pakistan. I look forward to a lively and interesting discussion. So now over to you, Fardad.
Thank you so much, Juan. Thank you so much. So good morning, good afternoon, and good evening, respectively, to all of our participants and panelists who have joined us in this webinar from around the world. I'm excited to be a part of the Pakistan-U.S. Alumni Network Public Health Interest Group's webinar on defeating antimicrobial resistance through awareness, advocacy, and outreach. So today's webinar is being conducted as part of our ongoing activities, as mentioned by Juan. And we have an esteemed list of panelists for today, and I would like to introduce them all to the attendees of the webinar. I'll try to briefly introduce them because their list of accomplishments is huge. So we have Dr. Zaman, who is a professor of veterinary preventive medicine and the founder and director of the Animal Population Health Institute of College of Veterinary Medicine and Biomedical Sciences at Colorado State University. He's a diplomat of the American College of Veterinary Preventive Medicine and a fellow of the American College of Epidemiology. His research interest focuses on surveillance and survey methodologies for animal diseases with emphasis on infectious diseases and zoonoses. Many of his research activities are focused on stabilization and redesign of national animal health and public health programs. Thank you so much for joining us, Dr. Mo. We are really glad to have you here.
Thank you so much, Fardad, and also to Mr. Juan German for the introduction. And it's my pleasure to participate in this panel. I should say, well, it's listening to Juan. I think I'm one of the oldest fellow for the Fulbright scholarship. I was the senior Fulbright scholar in Kathmandu in 1991, and I'm flattered to be asked to participate in this, and I will admit it, I have not really contributed a lot to the program since then, except by contributing it through the participation and training of some of the people. My assignment for today is mainly to introduce the AMR and also to the factors associated with it. So I put my 5 minutes presentation into 5 questions, and I will try to respond to each of the questions as I move forward. So the first one, which is very simple, is what's AMR? As Juan indicated, is the antimicrobial resistant pathogens. I would like to emphasize, we are talking about pathogens. And here is, majority of them is what we like to call the bacterial species, but let's not forget the antimicrobial resistant pathogens includes multi-cells pathogens such as parasites, and also some of the vectors associated with the disease that can be transmitted to both humans and animal population. The second question, what do we know about the reasons for having AMR? I think I will put it into two reasons. First of all is nature is so powerful, and pathogens evolves as we move forward in our life in general. And they're mainly the evolution of the pathogens similar to us as like human beings in so many ways. The evolution comes mainly either because of the negative impact from the environment, but also could be the positive impact in the environment. So during the evolution process, some of these pathogens will become resistant to whatever negative or adverse effect that we introduce or nature will introduce in that way. The second reason is, if we listen to at the time when the first founder of the antibiotics is Alexander Fleming, when he found the naturally existing fungal, it's called penicillin, and that can really destroy some of the bacteria. He also cautioned us at that time, like sometimes we need to be very careful because these pathogens or these bacteria could build some resistance after a while. And that's where I think is the second reason, because we either abuse or overuse or like extend on the use of these antibiotics that led to the resistance in some of these bacterial, especially bacterial species, but also later on other parasites and vectors that associated with the disease. My third question is, what are the factors that can influence the modification of the natural characteristics of these pathogens? As I indicated in my response to the second question, nature is really not only powerful, but it has full of the surprises in a lot of ways. And by doing that is also can affect the evolution, and by that way it can affect the resistance to some of the adverse effect, and that's where the factors, like I like to call it, non-manageable factors, we cannot manage it. The second group of factors is what I like to call human-caused factors. That's the one we can manage, and that can influence the resistance in these pathogens in that way, such as the stress we put on ourselves, either like we do it like because of our job, but also we could do it because of the other reasons, like our type of lifestyle in that way. But also there is the social modifications to our life, all the way from the way we consume food to the way we behave with the nature, that it can affect the resistance to this bacteria. And and also in terms of the animals, the production system, how we put stress on the animals, but also how we treat the animals, that can lead maybe overuse or abuse of the use of some of the medicine and the therapies we can use that led to the this type of the AMR. And the fourth question is, what are the impact of the AMR on sustainable development goals. I really like to put it into three major components. One is food sustainability and food security, mainly through the reduction in the valuable diet we eat, or also in the, like, even to lead to the child deaths in that way. The second one is the global health. A global health in such way, like, because we are expanding on some of the diseases that can be really treated if we have the control on them in the beginning, but then later it become very expanded because of the abuse of the medicine and the therapy. And the third one is the disease manifestation in terms of the severeness of the disease in that respect because of the resistance. And finally, the last question, and I see like Fardad is telling me like maybe time is over, is what is needed to be done in terms of the reduction of the impact of the AMR. I really think the best thing is to say best practice in the therapy and the stewardships of the use of the antibiotics and medicine in general. The second one is education and awareness and in general to the public. And the third one, which I think is where the focus in Pakistan is to build surveillance and monitoring system that it can really be prepared for any type of the AMR in general. And that's the end of my 5 minutes, little bit introduction. Thank you.
Thank you so much, Dr. Mo. Before I proceed with the introductions of the the remaining panelists, I have a request from the US Embassy staff. Shanil, I will hand over the platform to you so that we can do the
Sure, let's take a group photo. So because I need to seek informed consent of all my participants and panelists for this. So in case you want to be part of the picture, which we'll be using for reporting purposes and for our social media, you are requested to please turn on your cameras. We'll be waiting for like 15 seconds or so, because I can still see a few more non-video participants. So let's just wait for them to turn on their cameras. Otherwise, we'll be proceeding with the ones who have turned on their cameras already. Okay. That's it? Okay. Yeah. Zaman is also there. Osman is also there. Okay, perfect. So on the count of 3, please, I want you all to please give me a big fat smile. 1, 2, 3. Perfect. Thank you so much. I need to take one more just in case the previous one doesn't turn out to be good when I try to process it. On the count of 3, please. And for this one, I would like you to make some gesture just like thumbs up or anything like that. On the count of 3, please. 1, 2, 3. Yay. Thank you so much, everyone. Just loving the energy of this group. Back to you, Fardad. Now I'm perfectly for sure going to zip up my lips. Over to you.
Thank you so much. Thank you so much. So the way we have planned this webinar is that I will introduce the panelists, and then we'll move on to the discussion, and we'll give each panelist the time to speak about their specific areas. Dr. Mo, I did not have the heart to stop you. Thank you so much for that enlightening talk. We have covered the main areas of the AMR and the issue that it poses to human, animal health, and environmental health. And now we'll dive deep in those moderated sessions and those Q&As. So moving on with the introduction of the panelists, our next panelist is Dr. Mohammed Zaman. Dr. Zaman is a Howard Hughes Medical Institute Professor of Biomedical Engineering and International Health at Boston University. And a major research theme in his lab focuses on developing solutions to improve access to quality care in low-income settings, and including in refugee settlements. In addition to over 130 peer-reviewed research articles. Dr. Zaman has also authored 2 books for broad audiences. His first book, Bitter Pills, looked at the global challenge of substandard and counterfeit drugs. His second book, Biography of Resistance, is focused on global antimicrobial resistance. Professor Zaman has written extensively on innovation, refugee, and global health in newspapers around the world. His newspaper columns have appeared in over 30 countries and have been translated into 8 languages. He has won numerous awards for his teaching and research, and the most recent being the Guggenheim Fellowship for his work in antibiotic resistance in refugee camps. Thank you so much, Dr. Zaman, for joining us.
Thank you so much, Fardad. It's a pleasure to be here. So tell me, Fardad, what do you want to talk about? Dr. Salman touched upon a bunch of things. So I don't want to repeat what he said. So tell me what would you have me talk?
So I will proceed with the introduction of the other panelists as well, and then I will come to all of the panelists with individual prompts and what we want to talk about.
Great.
Thank you, Dr. Zaman. We also have on our panel Mr. Pasawad Jorakai, who is the Southeast Asia Regional Microbiologist and the Fleming Fund Management Agent for Mott MacDonald. Mr. Pasawad has a major background in medical technology with specialty in microbiology, biosafety and biosecurity, bioinformatics, and health informatics. His work experience spans over 17 years in the microbiology field, with 12 years with the US CDC Bangkok office as the senior microbiologist. Mr. Pasawad is a published writer and has published 18 scientific manuscripts in high impact journals in clinical microbiology and public health. Thank you for joining us, Mr. Pasawad.
Thank you.
Next up, we have our very own Dr. Mohammed Zaheer, who is the only Pakistani veterinarian with a US board certification in veterinary preventive medicine from the American College of Veterinary Preventive Medicine. Dr. Zaheer holds a PhD in epidemiology from the Colorado State University, where he completed his studies in the US Department of State's Fulbright Scholarship Program. Dr. Zaheer is currently affiliated with Health Security Partners as a surveillance lead in the animal health sector, where he works with government stakeholders to implement the One Health approach to develop policies to reduce drug resistance in the animal and human health sector. Thank you so much for joining us, Dr. Usman. On the panel, thank you. On the panel, we also have Dr. Kashif Sangrasi, who is an experienced public health professional with a demonstrated history of working in maternal, newborn, child health, non-communicable diseases, antimicrobial resistance, clinical, and community health program. Dr. Kashif has worked in the humanitarian and development sector for over 8 years with a focus on health system strengthening. He has program management experience with leading national and international non-government organizations. Dr. Kashif works closely with stakeholders in reviewing the program performance, defining strategic priorities, managing risks, and assessing the impacts of interventions. Thank you for joining us, Dr. Kashif.
Pleasure being with you. Thank you.
Last but not least, we have Ms. Rafia Rajput, who is the Communication and Outreach Specialist for the Fleming Fund Country Grant Pakistan. Rafia has been a passionate development sector advocate with a focus on access to healthcare, equal rights for women, children, and rural populations. Previously, she has managed the advocacy of Bill and Melinda Gates Foundation program to promote child health communications and policy initiatives in Pakistan. Ms. Rafia is an accomplished and enthusiastic professional with extensive work experience in the communications sector and has worked with national and international organizations such as WWF, European Union, UNICEF, Bill and Melinda Gates Foundation, FAO, and the United Nations. We are glad to have you here, Ms. Rafia.
Thank you so much for that. Thank you.
All right, so now we will move to our panelists to shed more light on the issue of AMR. As Dr. Mosalman has already indicated in his talk, this issue is grave and is a global public health concern. Each year, almost 700,000 people die from drug-resistant infections, and if nothing changes, by 2050, AMR will be the leading cause of death, with an estimated 10 million deaths estimated. This will surpass the estimated 8.2 million deaths due to cancer. and the associated economic burden would mean a total GDP loss of around 100 trillion US dollars. Dr. Zaman, I will come to you with this question that how worried should we be? And especially in the low and middle income countries, how do you see the factors that are associated with the AMR development?
Thank you so much for that. So let me first make two comments. One is the fact that we are living in a pandemic, and then in general, there's a lot of fatigue about sort of an impending doom and all of that. So I want to sort of change the tone a little bit and be on the more proactive tone rather than one of doom, right? Because people are tired, people have sort of have been exhausted. So just telling them that another big problem is right around the corner often really tires them out. So I would sort of change the tone a little bit and say we can sort of control the future if we act rather than one that seems more inevitable. So that's the first point. The second one, I think, is a more interesting question. Are there unique drivers of drug resistance in low and middle income countries? So some of them are the same, right? So there is overprescription, and that's true also in the United States. There is lack of sort of awareness. That's also true in many high income countries. But then there are other challenges as well. So one of them is the quality of medicines. So in Pakistan in particular, where I've done quite a bit of work in this regard, but also elsewhere, there is an issue of drug quality that promotes drug resistance as well. So that's one issue. The second, of course, is over-the-counter use. That continues to be the challenge, not just in Pakistan, but in many other low and middle income countries, where, for example, at the beginning of the pandemic, in Lahore, for example, people were using amoxicillin for COVID prevention and COVID cure. And Lahore is one example of many other places where there has been sort of extensive use in outpatient in over-the-counter. That's the second factor. The third factor, of course, is in general the lack of surveillance and policy action. So we don't know, for example, in Pakistan and in many other countries where AMR hotspots are. We often do not require our hospitals to report. If there are reporting mechanisms, they're not always followed. So that's a sort of the top-down approach as well. And fourth and the final one, which I think we have to be sort of conscious about, is sort of just this overall framework which focuses towards sort of disease cure and management and very little on awareness and prevention. So the entire system of healthcare is on treatment and very little on awareness. I'll give a very specific example. If you talk to people in general about AMR, there would be very little awareness because the focus is on treatment, right? So you would sort of give treatment, and even the efforts that are made, and I'm being careful here, in local languages, they are not existent, or they would mean sort of the terms are so technical that they do not appeal or engage with the community. So I think some of those challenges remain in the context of low and middle income countries, all the way from sort of surveillance and easy access to antibiotics to more awareness at the local level.
That's so correct with the comment, especially about the emphasis of the system being on treatment rather than prevention. And obviously, irrational use of antibiotics becomes a major concern and is a driver for the increase in AMR. That's in human health. Dr. Mo, I will come towards you and specifically take your comment on how irrational use of antibiotics, antimicrobials in animals should be a concern or is a concern, and what are its impact on public health. So we'll kind of touch upon the concept of One Health here as well. So would take your comment here on that.
Thank you. I think I would like to add, is in animal side, there is for long time, I would say, abuse and misuse of the antibiotics, especially, or the antibacterial in animals, particularly in the production of the animals for food. And that one mainly because of the demand, and then I'm not trying to avoid that, is the demand from the public, human population for high quality and cheap production of food. And therefore, the abuse here came because the use of antibiotics will lead to more efficient, as it used to be called, more efficient animal production in that respect. But I want to look at it from the, let's call it from the half full glass of water. I really feel like I'm more, I would say, optimistic about the future, because there is a build on awareness of this abuse of antibiotics. Majority of the livestock productions now is getting less and less in the use of antibiotics as part of the feed additive. And that one, it's major reduction in the use of the antibiotics, which lead to the less of the pressure on the AMR in that respect. That's what I would like to say. Do we have a good system, or do we have a perfect system? No, but I think that's the direction I could see it. Unfortunately, the developing countries, they are still mimicking the old livestock production system in the developed countries, which they use antibiotics as feed additives. So what is needed now, beside building the awareness, it needs some regulations in the developing countries in order to reduce that type of the abuse of antibiotics. Over.
Certainly, Dr. Mo, and Dr. Zaman, I'll come back to you. You briefly touched upon how irrational use of antibiotics in humans leads to increase in AMR. In addition to enhancing awareness in public and in practitioners, what do you think are the best case practices from around the world that can be implemented in developing countries, especially like Pakistan, to curb this irrational use of antibiotics in humans specifically?
Yeah, so I think a lot of it. When I mean awareness, I mean broader awareness. So you should have to think. I mean, you'll have to think about sort of public awareness on the demand side of the equation, where you have patients demanding or expecting that they'll get antibiotics, but you also have to have a pushback from the supply side as well, where the doctors and the clinicians are also saying, look, we are not going to give it. And that's a problem not just in Pakistan, that's a problem all over the world. Ask yourself, looking at the pharmacy curriculum, is the trained pharmacist aware of antimicrobial resistance? So there's an educational component as well. In the training of the doctors, how much emphasis is paid on that, right? So the awareness part cannot just be a public issue. It has to be that of the practitioners as well. I know people in my family in Pakistan, doctors who would prescribe antibiotics on the phone, right? Somebody's coughing, somebody would say, well, why don't you start an antibiotic, right? So the issue is not just of the general public, but also of people who should be trained better. So that's the side. And then, of course, economics play a huge role. So you have to recognize that antibiotics are subsidized, they're highly affordable, and there is a market demand for it that is fulfilled by the pharmacist. And the person working at the pharmacy is not typically a trained pharmacist. That person is basically learning on the job. That person is not coming out of a pharmacy school. So that really creates a problem as well. The final thing which I want to sort of emphasize and taking slightly different route, there are plenty of people in Pakistan who also die because they don't get the antibiotics they need. So it is not just the issue of excess, it's also the issue of access. There is a disparity here. There are people who should get antibiotics and don't, right? So there are plenty who get antibiotics when they don't need it or when they shouldn't have it, but there are plenty who actually don't get the antibiotics they need. So you really need a much more finer resolution of things, because that is just as evil to do that, as one would imagine, is to take antibiotics. So one has to think about awareness in a broader, holistic way. Prescription drug laws don't exist. Quality control is an issue in terms of quality. And of course, then training, not just awareness, training there. And finally, in Pakistan and low and middle income countries, one thing we have to emphasize, which we don't have, is any susceptibility testing, right? So if you were to go and get your blood test done, most likely it will be a cost, out-of-pocket cost for you. So there's a disincentive for anybody to get any testing done because that person has to pay for it themselves, right? The system doesn't do that, right? So you go to Khan labs or Chuktai labs or somewhere else, and you have to pay for it yourself. And that cost is quite high, which means that you wouldn't want to do it. And you'd say, it's just easier for me to just start taking an antibiotic. Why should I pay extra to find out whether my disease is resistant or not? Because it's a lot of money. So you really have to think about these. And as I'll talk about that later, many of these solutions are actually policy and economic. They are not technical solutions. They have nothing to do with basically new discovery of drugs. They have everything to do with governance and policy.
Everything to do with governance and policy, Dr. Zaman, and I'm so glad you mentioned the AST side of it. And it goes on to show how a multifaceted issue is, and it requires a kind of a holistic response to that. And related to that testing, I would take this conversation forward and go to Mr. Posawat and ask him specifically about the role and the importance of laboratory diagnostics to curtail antimicrobial use. We briefly touched upon it, and I would give the floor to Mr. Posawat to take it forward from here.
Thank you. For my question about the role and importance of the laboratory diagnostic to curtail antimicrobial use, I think that before we can understand our role and how it's important, we need to know the background first, that what we do. Let me share my screen for the presentation. Just few slides. Okay. Okay. We need to understand the real problem of the AMR, the complex issue. Cause of the AMR, we have 4 issues. The first issue is about the over-prescription, self-prescription, and compliance of when the patient use the wrong antibiotic. And the second about the weak regulation and inadequate enforcement. The third is greater competition, aggressive marketing, and spectrum from the pharmaceutical industry. And the last one about the lack of coordination between human and animal healthcare authority. As other panelists said about the food safety, because the antibiotic not used only in the human, but also used in the animal. Sometimes they use not because the animal sick, but they use for the growth promoter. And they have some effect from the antibiotic used in animal transfer to the human by food. When we know about what is the complex issue of the AMR, then what is our weapon to fight with the AMR? Data is provide the power to tackle to the AMR, and how we can get the data. Data is come from the patient and the laboratory. When patient visit to the hospital and they're sick, and clinical team, they send the patient specimen to the laboratory team. And then after we finish for the lab diagnosis, culture, identification, susceptibility testing, we send the result back to the doctor. That the first role of our laboratory diagnosis is the patient treatment. And not only that, we also send the laboratory result to the surveillance team. For the surveillance team, they collect the data from both laboratory and the clinical team together, and they analyze it to the AMR surveillance data. And they use this surveillance data to draft the empirical treatment guideline to the doctor, and also used for the local AMR control strategy. And they are not only in the local level, in the national and international level. We also use the AMR data for better understand the situation of the AMR globally. And for the question about the importance of the laboratory diagnostic to curtail the antimicrobial use, I think we have only one answer for low and for important. Answer for the low is we make the evidence base of the AMR severity in all level. That is our role in the laboratory diagnostic, because we understand, we know, we heard from many sources that AMR is the big issue, AMR is very serious, AMR is a big problem. But everything by talk, we have no evidence, and we need to evidence to support to our discussion that it's a real problem to the global about the AMR. And the important, we need to generate data to use for the guideline for antibiotic stewardship and policy change. When we have good antibiotic stewardship program and we have the policy change on the AMR use, that can solve the problem for the AMR and can reduce the antibiotic use. That's my answer about this question. Thank you.
Thank you so much, Mr. Prasavan. And as very clearly stated, there's data for AMR related to AMR is so important and can only be generated through effective surveillance systems. The Fleming Fund Country Grant Pakistan has been working since 2019 with the national reference laboratories in Pakistan to implement a surveillance system based on the GLASS guidelines. And Dr. Usman Zaheer, I will come to you for this question, like what is the status of this AMR and this AMU surveillance in Pakistan? And if you can shed some light on the strengths of this current system in place and the areas that can be improved upon to make it more effective.
Thank you very much, Fardad, for this question. Before I start giving a response to this question, I would like to give some background to what has been happening traditionally, specifically in the animal health sector for antimicrobial susceptibility testing, as Dr. Hamid, Zaman, and Posawat has touched upon. In the animal health sector, traditionally, testing have been done, laboratory diagnostics have been done on sick animals to guide the clinicians on how to prescribe or what antimicrobials to prescribe. However, as other panelists have very eloquently described, that AMR is not just a problem for animals or just the humans. It is a multifaceted problem which require a One Health approach, which require surveillance in different segments of our ecosystem, including animals, humans, and the environment. With that in mind, if we consider the public health aspects of antimicrobial resistance, and if we try to link that with the animal health sector, as a humans, we consume food that is coming from the animals, which means we are consuming healthy animals. And traditionally, healthy animals have not been subjected to surveillance for antimicrobial resistance, because healthy animals do not require medicine, which means that they do not require antimicrobials, which means no testing is required in them. However, these healthy animals could be carrying these drug-resistant bugs, which could then be transmitted to people through our consumption of milk, meat, eggs, and other products from the animals. So with that in mind, and following the international guidelines, such as ones available from the World Organization for Animal Health and Food and Agriculture Organization of the United Nations, a regional office in Bangkok, we in Pakistan, the Fleming Fund country grant under the leadership of the Animal Husbandry Commissioner, Ministry of National Food Security and Research, developed a national surveillance guideline or national surveillance strategy for antimicrobial resistance in healthy food animals. So this was first of its kind document developed in the country, and we are one of the few countries in South Asia region to have, and Southeast Asia region to have this document ready, adopting FAO or Food and Agriculture Organization of the United Nations guidelines. So development of the document was one thing. However, it also required its implementation in the field. While development of the document, we took a consultative approach where we had inputs from different stakeholders in the country, including the development sector partners in human health, animal health, and the environment sectors to develop that document. After that, we initiated first ever field surveillance or field monitoring for these bugs in healthy animals, starting at slaughterhouses. Slaughterhouses are the place where animals are butchered or slaughtered, and we get those animals for our consumption. Likewise, we initiated it at chicken retail shops, like these chicken shops that are prevalent everywhere in Pakistan, where we get our freshly slaughtered chicken. So we initiated it from that point, just to get an idea of what kind of bugs are prevalent in those animals that we are consuming, because those bugs can then transmit to us through food, and these bugs can at the same time transmit to animal workers or other people at occupational risk of contracting those bugs. And likewise, these bugs in the healthy animals can also be transmitted to other bugs within the same herd or same farm where animals are sick, and then animals also get those bugs, and then they become resistant to treatments, and we are unable to treat the animals. So this is kind of surveillance that we have initiated in the country, and we are very glad to mention that it has been going on with the success so far. We have support from all the provincial livestock departments and at the federal level from the Ministry of National Food Security and Research. Over.
Thank you so much, Dr. Osman. I've been working closely with Dr. Osman, and I have seen the effort that is put in implementing these surveillance systems in Pakistan, and it shows how a coordinated approach it requires from different sectors. I would take a leaf from Dr. Zaman's book and not say fight, and just to give a positive outlook of it, but have a coordinated response towards it. And I will come to you, Dr. Zaman, regarding this. In terms of having a coordinated response towards this issue, how can we engage different actors and different sectors in this fight, in this response against AMR? From the work that you have done around the world, what are the best practices in terms of getting different stakeholder institutions to fight coordinatedly in eliminating this issue?
So for that, thank you so much. One of the things that you have to recognize is that there have to be multiple stakeholders involved, and a single top-down approach is not going to work. I'll tell you a story of when I was working on my book, Biography of Resistance. I met people all over the world, and I spoke to a farmer in Bangladesh, and he said, he told me that, look, for the first time in our history, in his family's history, there was meat on the table. They'd never had it. And now you, sitting in the US, come and tell me, stop using antibiotics because you are worried about your health. What's going to happen to the nutrition of my kids, right? So one has to really have a more empathetic approach and cannot use some kind of a top-down approach. And the same goes for climate change. The country that really needs to act is the United States, right? So they have been doing it for 200 years or more, and then you all of a sudden go and tell Uganda and Rwanda that they should just cut their emissions while US doesn't do much. That's not going to work, and that shouldn't work, right? So you have to push back against this colonial approach, but rather use an empathetic one that understands the issues and challenges of everyone. So I want to sort of really emphasize that you have to appreciate the unique challenges of all the stakeholders. There are plenty of people who are not getting antibiotics that they need. There are plenty of people who are forced to use antibiotics because there's nothing available. I work in refugee camps. I know there are colleagues here from many different parts of the world, including the Middle East. There, the antibiotic that you get is not what you need, is what they have. If they have Cipro, you get Cipro, right? In an emergency, that's all you get, right? If they have amoxicillin, you may need something else, but you get amoxicillin because they are trying to save lives and they use broad spectrum antibiotics. So you really have to understand the needs of the stakeholders. We've never had that honest conversation. We think of it as a top-down approach and try to impose it and are surprised every time when it doesn't work. Well, it's not going to work. What you really need to do is to really understand the needs of the farmers, the needs of mothers and children, the needs of small hospitals in rural Pakistan, and try to understand what they have and what they need. You have to look at the veterinary sector. And if you're able to really want to have a strategy that works and clicks, you have to have both a top-down and a bottom-up approach.
That rings so true, Dr. Zaman, especially the part about being surprised after trying the same things and then expecting different results. Dr. Moore, will come to you and get your comments on this as well, on the importance of a multisectoral approach towards eliminating this issue, because I do know that you have in your extensive career worked a lot on getting different stakeholders on the same table and getting them to agree on a way forward. So please shed some light on this.
Thank you for that. I am in full agreement with Dr. Zaman as far as the top to down approach is not the way we should go. I think we need to do both, top to down, but also bottom up. But I also feel like one thing we need to not ignore, and I think Dr. Zaman actually emphasize on that, is the education and the awareness of the medical professions. That's a part I really think is very important. Yes, there is a lack of, in some situation, lack of the antibiotics, but there is the other side in which the antibiotics are not used as properly, whether this is in animal side or in the human side. What I mean by properly, is then not to continue with the course, whether we talk about in a refugee or we talk about in a big city in United States, is when a physician, or in that matter, even a veterinarian, will not encourage the patient or the animal owner to go and say, well, this antibiotics has to be used for a full course, okay? Otherwise will not be effective. So we are actually manipulating nature in some way, because we are allowing some of these bacteria to evolve and to be multi-drug resistant, such as what happened now with the Mycobacterium tuberculosis and Mycobacterium bovis. That issue, I think, is the responsibilities of everybody. I am in favor of regulations and policy, but regulations and policy will be only on paper if there will be no education and awareness by the users and by the providers. And I think, as Dr. Paswat indicated, about the competitions especially among the pharmaceutical companies, and how they can produce and sell a lot of antibiotics in that way. I think that, and I'm trying again to be very positive, I think that is being changing now. These pharmaceutical companies, because of the pressure from the community, they are trying to be more reasonable, but also the pressure, legal pressures. When they saw what happened with the use of some of the drugs and then how patients can sue them, then they started to think carefully. I feel also we need to encourage the research and development of alternatives to the antibiotics, okay? And that, I think, is Dr. Zaman indicated the holistic approach. I really think there are several ideas and very effective ways that it can be utilized for how we can treat some of these bacterial and other parasites, as they have done in Africa with some of the ticks, or also in Australia, or what they have done in Denmark, for example, with the using of let's call it like the good microflora as part of the building the resistance to some of the diseases in that way. Over.
That's really interesting, and especially in terms of how people from different sectors have to come together and to find the optimum and the most efficient response to a problem. Before I go to the next panelist, I would also encourage all the participants and the attendants, if you have any questions, don't hesitate to put it into the chat. And after the panelist talks, we will go through the questions and pose them to the relevant panel members. Talking about the multisectoral coordination, Dr. Kashif, I will come to you specifically with the question of how your experience has been in terms of the multisectoral coordination in Pakistan in fighting AMR. Like, what are the lessons so far in the work that you have done as part of the Fleming Fund Country Grant Pakistan? What are the lessons learned, and what do you see the way forward to be? Dr. Kashif, please.
Thank you, Fardad, and thank you all the panelists for shedding light on this important issue. In Pakistan, as you're well aware, just to give a bit of background, we have a devolution system in which the provinces are working independently now. However, the federal government is responsible for coordinating all the international health regulation agendas, including antimicrobial resistance. And for that, National AMR Action Plan has been in place in 2016, and with National Institute of Health that mainly deals with human health diseases, is guardian and focal point for coordination with all the other relevant stakeholders, including the Ministry for Livestock that Dr. Usman just mentioned, and also from the environmental sectors. They have been working on small-scale pilots that included various sectors. So there was a WHO project on ESBL E. coli, which they have successfully executed in the Islamabad and Rawalpindi regions, and they're trying to extend it. And it has a multifaceted approach from human, animal, and environmental health. Under Fleming Fund, we have been trying to strengthen the overall AMR coordination, both at the national and provincial levels, with using both top-down and bottom-up approach, as Dr. Salman rightfully summarized. At the national level, we are trying to support NIH with through establishing an AMR secretariat for multisectoral AMR coordination. And also, we noticed that there were a lot of components for animal and environmental health sectors that were missing in the National AMR Surveillance Strategy that was a base document for action against AMR. So we are trying to revise that surveillance strategy to incorporate missing elements from the animal and environmental sectors at the national level. And also through our AMR Secretariat in the NIH and also in the Ministry of Animal Husbandry Commission, we are trying to consolidate the findings and efforts through different departments. One thing that is missing that Dr. Zaman also alluded is the role of the DRAP, which is a Drug Regulatory Authority of Pakistan, is minimal at the present time, both in terms of the quality of the drugs and also for enforcing the legislations with regards to AMR. That is something that needs to be enhanced in the future. At the provincial level, we are also trying to build capacities of the provinces by establishing multisectoral coordination units at the provincial level, because having said that, they are now more or less autonomous post-devolution. We are trying to build AMR secretariats in 2 of the provinces, namely Sindh province and KP province. They'll essentially do the same work just like the AMR secretariats we have developed at the national level. They'll try and work for multifaceted AMR action under One Health, incorporating efforts from all the relevant sectors. They'll also try and work for realignment of the provincial AMR surveillance strategies in line with the national AMR surveillance strategy. And in the future, we hope that the AMR data and the dashboards that are being developed will guide evidence-based decision-making for consolidated One Health action. Over and out from my side. Thank you.
Thank you so much, Dr. Kashif. We have touched multiple times on the importance of communication and outreach and education and awareness in terms of how it can have a beneficial impact. I would take this conversation to Mr. Afia Rajput, who is the communications and outreach specialist for Fleming Fund Country Grant Pakistan, and especially focus on how Pakistan can work towards the containment of AMR through communication and outreach specifically, and what your experience has been. Rafia, please.
Thank you for that, and thank you, panelists, for such insightful thoughts, for sharing such insightful thoughts. I think I will second with Mr. Hamid's point that people here are tired with so much negative information, and especially during COVID-19. So in order to curb AMR threat, we need new and creative ways of communication. We cannot rely on statistics and data in order to bring people together against this AMR threat. Like, for example, we wouldn't be able to make people realize the importance of child education without campaigns like Hum Roshan to Kal Roshan, and we couldn't be able to make people realize about the family health workers without the proper advocacy and creative means we use to advocate health workers. So same goes with the AMR as well. We, in order to make people understand the importance of AMR and to deal AMR in urgent basis, we need to humanize our content and humanize our communication tools. Like, we cannot just rely on hard facts and statistics if we want people to relate, to understand. It is also necessary to understand the target population of our country. Like in Pakistan here, if we see the literacy level is very low, so we cannot just we cannot give information to a farmer with status or with a policy brief. So we require to have information mean like such as of advertisements and dramas, and now even our YouTubers, our influencers are a good mean of transforming those information. If I sum up my what are the effective health communication means and how we can do the effective health communication, I would say that we should not only rely on relevant and accurate data, but also humanize that data, as people are relying on true stories and real life stories and layman discussions, and content should be culturally competent, taking into considering that difference in the audience educational level and for religious and their cultural belief. Also, it should be easily accessible in terms of education and lecture in mind how we are going to reach our target audience. Like media, for instance, we used media for Fleming Fund for the outreach of Fleming Fund and AMR. And I believe that we are mostly successful, at least to reach our stakeholders. And last but not least, we should balance and recognize the risk of infodemic. We are in the pace of information epidemic, so we should keep in mind that challenge as well before designing any communication campaign for Pakistan, especially. Thank you.
Thank you, Ms. Rafia. And then, as pointed out in the chat as well, it was an excellent point on contextualizing and humanizing the issue, and specifically keeping in mind the pandemic fatigue. We have to come up with more creative ways of communicating this issue. Thank you for that point. As per the agenda, we are 3 minutes over our allocated panelist talk, but I do want to kind of summarize and conclude this session, and I would want to do that with some kind of a take-home message from the panelists, and specifically keeping in mind, because we have practitioners in the attendant, we have the general public, we have policymakers as well, and prescribers as well. So in no particular order, I would like you guys to have to give some kind of a take-home message for the participants, for the attendants regarding this issue and where we are headed. Dr. Zaman, I will, because I can see yours first. After mine video, I will just begin with you, and then we'll move on to the other panelists.
Thank you so much. I think it's important to have these conversations, and I think it would be important to have these conversations not with a group of experts as we do right now, but rather with sort of the general public, with people who come from different disciplines, farmers and people in offices and people who are at home, and the elderly and the young. So having a conversation is absolutely important. I think that's where we ought to start. As Dr. Salman said, that we need to have both a top-down and a bottom-up approach. Oftentimes the emphasis is too much on the top-down and not so much on the bottom-up. Having YouTube resources, having good books, having perhaps a conversation on television that is engaging, absolutely. I'd say something along those lines. I don't want to take up too much of the time because I know you're already over time, so I'll stop there, but happy to sort of have a conversation anytime on this.
Thank you so much, Dr. Zaman. Dr. Mo, towards you for some kind of echo message. Can everyone hear me? Yeah.
Yes.
So I was just saying to the other panel members, if you would like to give take-home messages for the participants, for the attendants, please do so.
Okay, for that, I will start since you ask and we don't have a lot of time. I look on the pandemic fatigue, as Dr. Zaman indicated. I look it as an opportunity because it's really building the awareness of the importance of infectious diseases. I think Pakistan is on the right track because you started by collection of data information. You started by building guide that is needed. But as Dr. Zaman indicated correctly, is you need not to focus from the top to the bottom. You need also to engage other sectors as much as possible. And that will require both national and international resources and commitment. And that, well, I think is needed to be done in that way. So I am more optimistic than pessimistic in that way. And as Dr. Usman indicated, Pakistan could be a model for the region in that respect. Over.
It's very heartening to hear that. As we will take take-home messages from other panelists as well. But at the same time, I want to encourage the participant attendants, if they have any questions, share them in the chat. If you want to ask those questions directly, use the options of raise hand so that we can pose that question to the panelist. I will also request my moderator Juan to help facilitate this Q&A session. And as we proceed, just want to take if any other panel members wants to give a take-home message, and then we'll move to the questions. We already have a raised hand. We'll do that after your concluding remarks.
Hello. My question is from Dr. Usman. Yeah. Am I audible?
Yeah, you are audible. Just give us a minute and we'll come to you. If there's any concluding remark from the other panel members, we'll take that and then we'll come to you for your question.
Fardad, can I add something?
Sure, Dr. Usman, sure.
Thank you very much. And such an enlightening talk from other panelists as well. I'll just add one point that we can all take home. We are not talking about no antibiotics. The aim overall is to use the right antibiotic at the right time. And if we talk about the animals, in the right animals. It's not that we do not use antimicrobials. Antimicrobials are life-saving drugs, which are essentially required for treatment, control, and prevention of diseases in animals. However, that has to be coupled with the laboratory diagnostics in right animals at the right time. And pretty much from my, hopefully the same stands true for humans. We are not saying no antibiotics, rather we are saying right antimicrobial at the right time for the right purpose in humans is fine under the advice of a medical doctor. Over.
Thank you so much, Dr. Usman. And before we come to you, Maham, we would, as indicated, we do want the participants to introduce themselves as well, so we get to know you better. Please introduce yourself and then ask your question.
Hello, everyone. My name is Maham Habib, and I'm a veterinary doctor. Right now, I'm doing my master's from Cardiff University, UK, and my thesis mainly revolves around antimicrobial resistance, AMR and AMU. So basically, my question is from Dr. Usman. So how can we relate all this approach with the antimicrobial resistance approach with our academia? How all this can be implies to our academia, and what interventions could we make in our academics to have better outcomes?
Thank you very much for the question, Maham. It's a very important and a very crucial component of the overall AMR containment, our collaboration and our interventions with the academia. As Dr. Hamid has rightly indicated about pharmacists, the same holds true for medical doctors as well as for the veterinarians, that we all come out of our undergraduate schools, and it really depends on what we are taught. So in terms of, say we take an example of veterinary professionals or veterinary doctors, the Fleming Fund has recently conducted some knowledge, attitude, and practices surveys in the field, where we have collected the real-time and first of its kind data from field veterinarians and farmers to identify what is the level of their knowledge and what is the level of practice, if their knowledge is actually being translated into practice or not. And I'll not be sharing all the results here, but I would just say that there are limitations in the knowledge of the veterinarians that were surveyed, which means that there is not effective literature or curriculum available in our veterinary schools. Probably the same holds true for medical schools and the pharmacy schools. So which means that there is a dire need to work with the academia, to work with the veterinary education establishments, work with the regulatory authorities such as, say, Pakistan Medical Council and Pakistan Veterinary Medical Council or Pakistan Pharmacy Council to incorporate antimicrobial resistance related topics in the curriculum, so that the veterinarians or medical doctor or pharmacists that come out of those schools are aware of the antimicrobial resistance as an issue, and then they can translate their knowledge into practice. So that's another, that's one of the key things that we need to do. And in this regard, our team have planned awareness seminars for veterinary educational establishments during the Antimicrobial Resistance Awareness Week for the outgoing students to raise first of its kind awareness for those outgoing students. Over.
Thank you so much, Dr. Usman, for clearing out this. Thank you so much.
Thank you so much, Dr. Usman. My apologies for the background noise. There's a drill being used in the office right now. So I will try to make it. Yeah, so any other questions from the audience? If not, I have a couple of questions that I want to ask. All right, I will pose my question. So last year when I joined Fleming Fund program, I had absolutely no idea what a superbug is, and then now I've learned what these are and the issues it poses. As a very question, it has been mentioned about stewardship and what its role can be. Dr. Zaman, I will come to you specifically regarding this. Like, what does AMR stewardship really mean? And specifically in developing countries like Pakistan, what would it look like properly implemented?
Yeah, so I think stewardship basically means exactly what it says, that we need to be good stewards, good shepherds of the process, making sure that those who need antibiotics get them, those who do not need antibiotics are not using it incorrectly, and that needs to be done in a way that is both driven by evidence and driven by the latest information. One of the things that I think is lacking in Pakistan is just data collection in general. It's hard to collect data from our public sector. And it would be hard to make policies if you don't know how many antibiotics are used, who is using them, who is prescribing them. One of the challenges for that is there's little incentive. If you go to a public sector work, you'll see that hospitals are overwhelmed. There's just lots of people there. Doctors are stressed, and oftentimes there's no incentive to do stewardship, right? So the infectious disease clinics are just really overwhelmed, lots of patients, not enough resources. So you really have to create incentives. Let me also address Aisha's question here. One of the challenges we have seen in Pakistan, to be honest, is that even if there is data, that data sharing continues to be an issue. Oftentimes, either people are territorial or they're, let's say, are too risk averse or have just a sense of distrust. So even if data exists in one facility, too often it is not shared in a way that can create policies. We've had slightly better success in Bangladesh. I wouldn't say it's phenomenal, but slightly better success. And a lot of it has to do with trust. You have to create a system of trust, and nobody should feel that by sharing data, we are going to sort of penalize them or create some kind of a system that makes them feel bad about themselves, right? People are just really reluctant. We've been working with colleagues in Fleming Fund for the last year and a half, and it's just been a pleasure and a delight to work with them. But we are really struggling with good data and data access, even when that data is available, whether that's in DRAP, whether that's in public sector hospitals, whether that is at the governance level. It has been very, very, very hard. In some cases, even WHO is unwilling to share the very data that they collected in Pakistan with us. So the idea of stewardship will remain theoretical until we start to share the data that has already been collected and create an incentive for good data sharing. Everybody these days is jumping on the big data bandwagon, but that data is only useful when it is shared and available. Of course, you need to make sure it's ethically done appropriately. Of course, you need to make sure that it is done in a way that is doesn't pose a risk and goes through all the IRBs and all of that. But after that, we still struggle. And that's an issue we need to think about.
Thank you so much, Dr. Zaman. I think you also, in your response, addressed the question shared by Aisha in the chat about data sharing sensitivities and the challenge we have in Pakistan in obtaining like meaningful data from the authorities. The question is also being posed to Posawat in terms of how your experience has been from a regional perspective in terms of obtaining data. Mr. Posawat, if you can enlighten us with the experience you have had.
Yes. Thank you, Aisha, for the question. For the experience of the data sharing in Southeast Asia region, most countries, especially for the country who is the exporter of the animal product, like Vietnam, something like that, they are very serious to share the data to public because they worry about when they share the data to the public and that they have very high of the AMR in country, they may have economic impact from that import restriction from European countries, something like that. But for the country like Timor-Leste, that is very small country, or Papua New Guinea, that they have no export the animal product, they're not worried too much about this, and they're willing to share the data to the international to the WHO. Over.
Thank you. Thank you, Mr. Posawat. Are there any other questions from the attendees and the participants? I will also encourage the other panel members if they want to ask a question directed at anyone. I have a question in terms of the sustainability aspect of AMR containment efforts, especially in low and middle income countries. Dr. Mo, I would come to you with this question. How, with your experience of working with different projects across the world, how do you see in terms of this challenge of sustainability and the need for governments to take up the responsibility of working towards this? I would like to hear your comments on that.
Well, the answer is money. Okay, I think is majority of, especially in the developing countries now, is they put different priorities, and I think is if there will be awareness of the importance of the health and the infectious diseases and the applications of antibiotics or the antimicrobials, I really believe there will be some different resources that it can be tapped on for this type of activities. But it will require reliable planning and for long term, and with not promising something that it cannot be delivered. Politicians have the tendency to have very short memory, okay, similar to fish. If fish would know there is oxygen in the air, they will fly now, okay? So because of that, I think is they are decision makers, and there is a need to build on very effective achievement that it can be delivered, so they can continue the support for that activities. Over.
Thank you so much, Dr. Mo. We have a raised hand, and Dr. Usman, to you, please.
Thank you so much for that. Dr. Mo has indicated a very important and valid point for the sustainability of such efforts. And I just wanted to give some insight from my perspective onto the sustainability of these efforts. I think sustainability has different components or different at different levels that we have to work on. It starts off with the donors. For instance, we, the Fleming Fund, or other donors who are working on any issue, including antimicrobial resistance, we have to try to build capacity in the government institutions, so that once we are gone, the government institutions, their people can take over and they can start delivering. For instance, if there are training programs for, say, laboratory personnel, we should, as a donor, try and make every effort through advocacy with the government that only the most relevant people are invited to those trainings, so that once they go back to their duty station, they can start performing their duties efficiently. Likewise, if while we are working in the field, if we are initiating a field awareness program in the country, as a donor, we cannot reach every single person. However, we can adopt a model of training of trainers, TOT model, where we train the government officials, some of the key personnel, and then they trickle it down for further trainings in the field. Whenever the donor has gone, they can take over. Likewise, at the policy level, as a donor, what we can do is we can develop and initiate advocacy programs at the higher level. For instance, the Fleming Fund had reached out to the president of Pakistan in February of this year. And then we have had meetings with the provincial governors in Punjab and KP. And these efforts definitely sensitizes the people in power, people in bureaucracy, so that because they are the people ultimately we have to go to. And like, for instance, even yesterday, the Provincial Assembly of Khyber Pakhtunkhwa was lit blue for commemorating antimicrobial resistance. At least it gives a message to the people in power that this is some issue that they may be working on, or that something could be coming to them. Likewise, we need to work with our sort of a lobbying with the politicians and legislators as well, so that they are ultimately the people who have to pass legislations from the legislative assembly, and then those will be trickled down. So that's, and I'll give you one more example of the Fleming Fund, what we have done for sustainability of our efforts. We have done trainings. At the same time, we have helped develop Government of Pakistan PC1 documents for indigenous funding from PSDP, which is the indigenous funding of the government in KP, as well as in the federal level, so that AMR surveillance and antimicrobial use surveillance and overall AMR activities can continue even when Fleming Fund has gone. Now we need to have constant advocacy with them so that these things get pushed through funding and the so that the work can. And I'll just give you one example. If we work together, we can do it. A very good news, everyone was talking about pandemic fatigue, that we should not talk about negativity. A very positive news that came out from the World Organization for Animal Health is that due to the efforts that different stakeholders have worked together, the use of antimicrobials in the animal production have decreased by 34% in the past 2 years. That has been through the concerted efforts of multiple disciplines and especially the veterinary medicine. Over and thank you.
That's indeed an encouraging news, and we do have a long road ahead of us in terms of fighting against and containing AMR. And I think the general outlook of this webinar and all the participants has been to have an optimistic outlook towards this and have a coordinated response to tackle this. In the interest of time, we will not be taking any more questions. I will hand the platform per se over to Juan for concluding remarks, and then we will close the webinar session. I really appreciate your patience with me, and thank you so much. Handing it over to Juan.
Thank you, Fardad. I just wanted to say this has really truly been an interesting conversation. I personally have learned a lot as a member of the general public. As Zaman has said, that conversation should be had with the general public because there's a lot of interesting information and a lot of things that the general public could learn in order to understand AMR. And so I do appreciate that you took the time today to speak to us, to have this conversation. I think it's really timely, and I think it will be beneficial for the future as well. So with that, I just want to thank our panelists for their expertise and for keeping this discussion very lively and engaging for our audience. And thank you, Fardad, for moderating this discussion. You're a great moderator and a great speaker. And everybody who organized this event, and to our domestic and international partners for making this a fantastic event as well. So with that, I would like to thank you on behalf of the U.S. Embassy in Pakistan, and I hope everyone has a great evening, morning, or I don't know, a late night if you're in Thailand. Well, thank you.
Goodbye, everyone.
Everyone.
Bye.
Thank you so much.
Thank you.
Shanila, do we have any closing, any remarks?
Nope. Thank you so much, everyone. Just love the energy and all the discourses which we had today. It was a lovely conversation, even for a non-technical person like me. So just love that. Thank you so much, everyone, for your presence. A special thanks to our panelists who spared their time to orient us all on such an important topic. So let's meet sometime soon again on some other topic, on some other forum, inshallah. Thank you so much, everyone. Bye-bye.
Good night. Bye.